change in the guidance that the UK government is giving, even if it's just for England, on the front pages of a Sunday newspaper. Craig Payton from PA.
Thank you, First Minister. Does a change in messaging from the UK government without any consultation with the other devolved nations make a four-nations approach harder or even impossible to achieve? Also, what did the Prime Minister say when you asked them for the Stay Alert advertising campaign not to be deployed in Scotland?
On that latter point, there are discussions between communications teams in the Scottish Government and the UK Government taking place as of now, or they have been taking place over the last little while. So I am confident that we will get that agreement, and the Scottish Government will continue to make sure that the messages we want through our advertising are the messages you're reading in newspapers or seeing on the television or hearing on the radio. In terms of the wider point, this is something I think that is, when we think through it, is not too difficult. And I think we actually have agreement here. I am absolutely committed to a four nations approach, cooperating, collaborating, where we can, aligning our messages. The fact that we, for good evidence-based reasons, sometimes take slightly different decisions or take those decisions on a different timescale should not be seen as a breakdown in that four nations approach. It's perfectly possible to have a four nations approach that accepts for pragmatic reasons that we may sometimes do things slightly differently or on a slightly different timescale. What does make a four nations approach more difficult to sustain in the future is if decisions are being taken and even inadvertently being presented as UK-wide decisions when they are not, without proper consultation. And that, I think, is what is difficult and what I hope we will not see in the future, where we can get back to a position where we are sharing our thinking and coming to views that even where we're doing things slightly differently, we understand each other's positions and don't then inadvertently end up confusing each other's messages. Simon Johnson from The Telegraph.
Obviously, thousands of Scots will watch the Prime Minister's broadcast tonight, and this campaign will run presumably on platforms such as Facebook, etc., where it may be very difficult to sort of screen out Scots seeing it. Is it actually possible to sort of toss it off Scotland and prevent Scots from seeing the new advice down in England? And are you concerned that confusion will result from this?
Look, I'm not. I'm sort of enough of a veteran of media, traditional and social, to know how these things work. I'm not going to be able to stop people in Scotland seeing this messaging. You know, people can see it on the front page of Sunday newspapers today. But I'm treating the people of Scotland like the intelligent human beings that they are. And I'm saying you may see this, but hopefully you will not see it in blanket coverage because you will see the Scottish Government message. But I am telling you and asking you to abide by the messages that the Scottish Government is given, because we're giving these messages for really good reasons, that we think they are the right messages right now to suppress this virus. And one of the reasons I stand here pretty much every day and deliver these messages is because I just think it's really important that you hear it directly from me or from the Cabinet Secretary and the CMO, what it is we're asking you to do, and that we're as clear about that as possible. And, you know, most of us are quite media savvy these days, so I think we can understand these things. So let's not overcomplicate this. People in Scotland, in terms of the advice that we are giving, listen to what the Scottish Government advice is and please follow that. If you live in England, you listen to the advice that the UK Government is given. If you live in Wales, you listen to the advice of the Welsh Government, and similarly in Northern Ireland. So, you know, I think people are perfectly capable of understanding that. Michael Blackley from the Daily Mail.
Hi, good afternoon. I appreciate that you are trying not to comment on decisions for England, but do you believe that the decisions that are going to be announced tonight could lead to an increase in infection rates in England, which therefore could have a consequential impact on Scotland's infection rates?
Look, we all have to be very conscious of the need to be very cautious right now. And of course, as I've said before, the virus doesn't respect borders. So if the infection rate was to run out of control in one part of the UK, clearly that has implications for other parts of the UK. And I think that says we all have to be cautious. But if the evidence shows that certain things can be lifted in one part of the UK without risking the virus running out of control again, then clearly governments in that particular part of the UK are entitled to make decisions based on that. So, you know, my overall watchword here is caution, and I make no apology from that. I've just been reading some material from Germany that suggests that the transmission rate in Germany, as they've started to ease up things, has gone over 1 again. Now, I certainly can't comment in detail on the position in Germany, but what that tells us is that the margins for error here are really narrow, and it doesn't take very much right now. It doesn't take many more social interactions between us, you know, between different households that are not mixing right now for that virus rate to start to increase. And that's why we have to be careful, because if we go too fast right now, we risk all the progress we've made. I don't want to be in a situation here where, having asked you to be in lockdown for 7 weeks now, that we get so impatient, and I get so impatient to tell you that I want to ease things up, that we squander all that progress and we end up in lockdown for a lot longer than would otherwise be the case. Nor do I want, in a couple of weeks from now, us to be looking at a situation where the virus has run out of control again, and you are saying to me, why did you not exercise a bit more restraint and caution? Why did you start to ease lockdown a bit too early? So I've said to you all along, these are really tough decisions. These are finely balanced decisions. There is no certainty about the impact of any of them. But in those circumstances, my duty is to be as cautious as possible, to do as much as we can to continue to protect health and to avoid people dying unnecessarily. And that is what I'm going to continue to try to do. Gregor, do you want to say a bit from your perspective about just the state of the evidence right now and the need for us to continue to be very cautious?
Yeah, I'd be pleased to. I mean, at the moment, like other people, we've been watching very, very closely a range of data that allows us to track what the current picture is for this infection and the way it's transmitted across Scotland. So we've been watching over the last few weeks very closely the number of new cases every day, the number of new hospitalisations, both to general wards and to ICU, and of course the number of deaths. And what that tells us is that very slowly we're seeing a gradual decline in the number of those cases, and that's very encouraging. But I emphasise again, it's been a very slow decline. And when we use that data to try to calculate where we are in terms of both the number of new infections across the country, but also this all-important R number, what I have to say is that there's insufficient confidence at this point in time to say that we're sufficiently below that magical 1 number to be able to say that any significant change in the restrictions that we're all enduring just now wouldn't lead us back into that exponential growth. And that's the real danger here, is that we relax things too early, make the changes too significantly, that the message begins to change, and that R number begins to grow. And of course, from that, the number of cases begins to grow, the number of hospitalisations begins to grow, and ultimately the number of deaths begin to grow again. So what we need to do, make sure that we are very, very cautious in our approach just now till we have sufficient confidence that we have sufficient headroom to make sure that any changes that we make don't impact on that overall rate of growth.
The other thing, I'm going to briefly bring the Health Secretary in at this point to talk about our work on test, trace, isolate, because the other factor here, which you've heard us talk about before, that as we do start to ease restrictions, and any easing of restrictions will have an impact on the R number, but the lower your baseline, the more headroom you've got to cope with that. But the more important it is that you have the test, trace, isolate infrastructure in place to identify any outbreaks and try to suppress them straight away. So another really important part of what we're doing right now is building very rapidly that capacity and capability for test, trace, isolate. And I'll ask the Health Secretary just to say a few brief words about the work on that front.
Thanks, First Minister. So there are a number of elements to creating the delivery of a test, trace, isolate strategy. Ramping up our testing capacity. We will be at 8,000 tests per day in NHS labs by the middle of this week, but we need to increase that further. So the work is underway to get us to 15,500 tests a day through those routes. We need to increase our teams of contact tracers. We do that in two ways: by our local health protection teams identifying how many more people locally they can bring in, but also by the national advertising campaign, which will begin tomorrow, to invite people to come and join us as contact tracers. The scaling up of the existing digital tools in Scotland that we use to track infections so that we can make best use of that as an aid to contact tracing. And of course, the really important work that needs to go on to identify the support that we will need to put in place to help people when we ask them to isolate. So all of that work is underway, and it is absolutely central to any easement of the measures of lockdown.
Thanks. Jean, can I go now to Paris Gertsianis from the Scotsman?
Thank you, First Minister. We understand from reports that there's going to be a 5-step coronavirus alert system set up by the UK government, controlled by a joint biosecurity centre. Is that your understanding, and will that have any impact on the process going forward in Scotland? And can I ask the Health Secretary, earlier today you were asked about guidance that means that non-coronavirus patients can be discharged from hospital to care homes. Isn't that an unacceptable risk, and will that guidance be changed?
I'll hand to the Health Secretary on the guidance point in a second. The alert system that you speak about, that's the longer term plan that the Prime Minister is going to set out tonight, or at least allude to tonight. I'm not sure if all the detail of it will be set out tonight. We haven't yet seen the full detail of that, so I can't really say whether it is a plan that we would sign up to or not. We will certainly consider it carefully, take expert advice, and it may be that we sign up to the general principles with the understanding that the phasing and the timing of the different steps and in that will be different. But I'll be able to comment more on that when I've seen more of the detail than I have right now. On the biosecurity centre, that's something that is under discussion. It's about this sort of data centre that would allow for us to make sure that data was being fed in so that we could track the virus, and that's certainly something that the Scottish Government will be talking to the UK Government and the other devolved administrations about being part of. I'll maybe ask Gregor to say a word about that, and then I'll hand over to the Health Secretary on the guidance point. So
I think that anything which gives us more information and more evidence, such as the way that we kind of collate data as 4 nations across the UK, is certainly something that we'd be interested in exploring. The proposals are still fairly new to us, and I think we need to understand the detail of them much more before we could give any kind of firm commitment. But certainly it's of interest to be able to kind of utilise that learning across the 4 nations. In terms of the alert system that accompanies that, again, I think we need to know more detail about how that would work in practice before we would be able to make any firm commitment to that. But as I say, the principles of it are certainly worth exploring just now.
Thanks, Gregor. And Jean?
The guidance I was asked about this morning is in fact draft guidance that was published on our website in error because it had not yet had clinical and governance sign-off. So we will finish that work, and the guidance will then be published very shortly. But the key point that I'm being asked about here is what happens with patients discharged from hospital to a care home. Now, we've been very clear that if the patient is in hospital because they had the virus, then they would give 2 negative tests before discharge. If they were in hospital for another reason but are being discharged to a care home, then they should give a negative test and be isolated in the care home for 14 days. The key issue here is that whilst the test is important, so too is really effective infection prevention and control in the care home, with staff who have the right kind of PPE, the confidence to use that PPE appropriately, and the training to undertake high-level quality infection prevention and control. It is all of those elements together that serve to break those transmission bridges that the First Minister talked about. And that is the work that we are working very hard on with our directors of public health, our local primary care teams, and of course in consultation with Scottish Care.
Thank you. Alistair Grant from the Herald.
Hi there, thanks very much. The SNP MP Angus McNeill has suggested Scotland's border with England should be policed if lockdown measures are lifted down south. Just to quote him, he said, "For the good of both populations, the Scottish border should be policed for day trippers or those whose trips are non-essential if the English decide they want to ease up." Are these comments something you would agree with? And is any kind of policing presence at the border something the Scottish Government has considered if further divergence occurs?
I've not seen those comments. I've been, as you can imagine, a bit busy today. The Chief Constable was standing here on Friday and explained the situation around the border. He used the example, for example, of different drink drive limits that already exist south of the border and north of the border. So the police are perfectly used to policing in an appropriate way along the border. I would stress that I think, although we have to wait and see, I would think in the detail of the positions between Scotland and the rest of the UK as of tonight, the differences will be minor. Obviously, we will see how things develop, but all of us have to be guided by the evidence, and we have to look at the implications of that as we go. But as I've said before, neither the government or the police have any plans to change the current situation around policing of the border or any other part of the country. Chris Musson from The Sun.
Hi, First Minister. Can you share your evidence with the public about the transmission rate, given this is shaping your policy? Can you be clear about how this all-important R number is calculated? Dr. Smith there suggested deaths was a factor, but what is it in the community? What is it in care homes and hospitals? Because if it is far higher in care homes and hospitals, how can you assure the public that we're not being kept indoors due to an inappropriate broad brush policy caused by the overall rate being skewed by these institutions?
Well, firstly, we will look to see what more we can publish. We want to be as transparent as possible. We have now published 2 documents that gives a lot of our thinking and a lot of how we are, of what we are basing that thinking on. We cannot yet say, certainly this is what the experts say to me, exactly what the R number is in care homes, not least because it's not a uniform picture across care homes. We still have roughly half of all of our care homes in Scotland that have had no cases of the infection at all. We have others that have had obviously very high rates of infections and sadly a high number of deaths. I would caution you against seeing though what happens in care homes as isolated from what happens in the community. There will always be an interaction between the two, just as there will be an interaction between infection rates in hospital and in the community, as particularly staff will go from a place of work into the wider community. So these things are more interlinked than you might think is the case. But we will continue to be as open and transparent about not just the decisions we're taking, but the evidence base of these decisions as we can be. Do you want to add anything, Gregor?
I think all I would say, just in addition to that, is that with the data that we have in this country, it is impossible to state with any degree of confidence at all. The modelling groups have looked at this quite extensively. At this point in time, it's impossible to state with any degree of confidence what separate R numbers might be for either hospitals or care homes. And what we have is the best estimate of the R number for the country as a whole, which includes all those 3 aspects.
Vivian Aitken from the Daily Record.
What is that number then? Can you tell us that number?
Well, I think several times now, Chris, I've said to you, I can't tell you that number because the experts tell me it's not possible to say with certainty what that is. If I do get told what that number is, just as we have done for the R rate or the estimate of the R rate in the community, I will share that with the public. I'm trying to take as open an approach to this as possible, but I'm not ever going to stand up here and just give you numbers that are not solidly based, however much you might want me to do that. So I'm telling you, and I've told you a number of times before, that I cannot give you that number right now. It's not that I don't want to give you, it's because I'm not able to give you that in a properly, solidly evidence-based way. Vivian Aitken from the Daily Record.
Good afternoon, First Minister. Last week you said that the leaked change to newspapers, of all those details, the thing that gave you the most concern was this change in messaging. And you said that after your conversation with the Prime Minister, you sort of indicated that you were on the same page re-messaging. Has the Prime Minister done a complete U-turn since your telephone call, or is the UK government treating the people of Scotland and her Prime Minister with contempt? And is the Prime Minister just saying what he thinks people want to hear at any given point of time?
Look, I appreciate that valiant attempt to put some provocative words into my mouth there. I'm going to resist that temptation, because I've said all along, this is not a normal, it's not a political situation at all. So, you know, the kind of rhetoric backwards and forwards between politicians that might be appropriate at normal times is just not appropriate right now. I only care about all of us trying to take the right decisions to tackle this virus as best we can. You know, heard the Prime Minister last week, I've heard him again today say that stay at home remains an important message. The question in my mind is how that fits with the change in the campaign that we've seen reported in the Sunday papers today. But since I am not proposing to make that change here in Scotland, I think it is probably better for me to leave it to the Prime Minister to explain how a stay-at-home message fits with dropping a stay-at-home message for England. I will continue to articulate the message that I want to give to you, the people of Scotland, which is to stay at home except for the essential purposes, because what I said last week, and again I'm talking for Scotland based on the evidence as I see it, to move away from that right now, to muddy the waters, to give people mixed messages and effectively leave people not really understanding what it is we're asking you to do and not do, would be potentially catastrophic, because it would lead to people perhaps through no fault of their own going out more than they should or mixing with people more than they should, and that's the circumstances in which we would see a rapid increase in the virus. So I will continue to articulate a message for Scotland that I think is the right one, and I'm afraid I'm going to have to leave it to the Prime Minister to, as I'm sure he will set out later on, to say why he thinks that change of message for England is appropriate and will not run the risks that I have expressed concern about. Severin Carroll from The Guardian.
Good afternoon, First Minister. Good afternoon, First Minister. You say that you've asked the UK government not to use the new yellow and green Stay Alert logo in Scotland. However, it will be visible in Scotland. It'll be on the UK broadcasters, TV, it'll be in UK newspapers and so on. Do you think that that logo needs a disclaimer? Have you sought or received guarantees that the UK government will make clear on that logo that it's supposed to be England only?
I have asked, not so, just to be clear, we've not yet specifically, and we'll certainly consider whether this would be practically possible or sensible in any way, but I've not asked for the words for England only to be put on the logo. I have asked, and hopefully this will happen, for the Prime Minister to be very careful when he is giving any messages or announcing any decisions where he is speaking for England only, and by contrast where he is speaking for the whole UK. So if he, as I would expect, announces border control tonight, I accept that he will be speaking for the whole of the UK. But when he talks about lifting restrictions to lockdown, he is only speaking for England. And in terms of public health advice, he is only speaking for England. And I think it is incumbent, just as I am being very clear, I am only speaking for Scotland when I say the advice is absolutely stay at home. And I think we all have to take care to make sure that we are clear about that. And, you know, mixed messaging here is not inevitable. Many people I know are watching this update, watching the UK government's daily updates. People are perfectly capable of working out where they live and whose public health advice they should be following. The public are far more intelligent than perhaps sometimes politicians give you credit for. So we'll continue to work hard to make sure the message that we are putting across to people in Scotland is the one that people understand is that they should follow. Muir Dickey from the FT.
Thank you. You made the point that you would not want the UK government to use its new Stay Alert message in its advertising in Scotland. Just for clarity, would you want them to continue that advertising campaign but using the Stay Home message, or would you rather they just stop doing their advertising at all? And on that, has the UK government given any response to your request on this?
As I said earlier, I don't know if you heard in response to the previous question, there was a communications meeting after COBRA, and I hope that agreement will have been reached in that meeting. We have our own stay-at-home advertising campaign. I was just checking, you can see an example of it behind me here. So any advertising space that the UK government may have secured in Scotland, we can provide Scottish Government public health messaging for that, as we have been doing at points previously. And so the Scottish Government's public health campaign, which is very clearly still stay at home, can be utilised for any advertising space in Scotland. Kathleen Nutt from the National.
Hello, First Minister. Professor Linda Bold was talking about the pausing of the cancer screening programme at Holyrood last week, and she was saying normally the programme screens something like 100,000 people a month. And have you any update about when the cancer screening programme will resume, and also if there's any plan to deal with the backlog?
Well, I'm sure you heard when we set out the regrettable decision to have to pause the cancer screening programmes, the reason for deciding to pause rather than try to continue them through this period. In response to part of your question, we are considering now how we resume NHS procedures that have been paused. The Health Secretary can say a word about that in a moment, and that will include screening programmes. But the reason we decided to pause was so that nobody would miss out and that we could then catch up with people. If we had carried on and somebody missed an appointment because maybe they had the virus or they were worried about going for their appointment in case it brought them into contact with other people, then what would happen by default is that they would then not get another appointment until the 3-year or 5-year or whatever the time scale of the screening is. By pausing, it means we can pick up where we left off, so nobody should miss an appointment. It will just be slightly later if you were due to be screened in this period than it would otherwise have been. So we will be able to catch up and deal with the backlog. And it was judged that that was less of a problem for people than carrying on and allowing people to completely miss their appointment in this cycle. Jane, do you want to say a word about restoring and resuming NHS procedures?
So a great deal of work is now underway to look at across the whole of the NHS, from primary care right through to acute care, about what might be possible in terms of restoring some of the areas that have been paused in order to allow us to be ready to deal with the pandemic. The two important points in this, one is that we need to be sure that we can retain a capacity to deal with COVID-19 cases, including if there is an increase in those cases, both in our bed numbers and also in our ICU numbers. And secondly, in looking at that work, we need to very proactively engage the widest possible clinical community about the views that they have. So the CMO has been in touch with the Royal Colleges. I have spoken to the BMA and the RCN. We have begun to alert the unions representing staff across our NHS so that we understand all the views that are coming, so we can make what will nonetheless be complex and at times difficult decisions about what it is possible to restart, but what isn't possible to restart because of the impact that might have on our capacity to deal nonetheless with cases coming as a result of the pandemic. And into all of that will go the screening programmes, because we share the very strong view about the importance of those programmes as preventative, as well as picking up individuals who are beginning to show signs that they might have cancer. So all of that will be factored into the mix, and we will absolutely be back making very clear to people the criteria we've used to make decisions, what the initial steps might be, and then what subsequent steps might be. But before I finish, the other point I need to take this opportunity to make, of course, is to remember that the NHS is open. It is open for urgent, for cancer, for emergency, and for maternity. So if you have any of those worrying symptoms that the CMO has described before, of course, if you have an emergency and if you are pregnant, then please be in touch with your NHS, because it is there to help you right now.
Thank you. Mark McLaughlin from The Times.
Hello there. Jonathan Ashworth, Labour's Shadow Health Secretary, said this morning, locking down some bits of the country and not locking down other bits of the country doesn't work. When that approach was attempted in Italy, lots of essentially middle-class people went from northern Italy to southern Italy and took the virus with them. So if the R rate is higher in Scotland, are you concerned that England's message will be seen as some kind of green light to go for a jolly in the Lake District or something? And also, you said that the public is smarter than some politicians might give them credit for and can understand nuanced messages. So why can't we have different messages for different parts of Scotland? For example, Greater Glasgow, stay at home. Inverness, you can, go about your day in a slightly more normal way.
If the evidence said that was necessary, and if we judged that that was practically deliverable, then I've never ruled that out. But we are not at that stage at this point. In terms of, again, forgive me, I've not seen John Ashworth's comments, but I also think it's really important we don't get ahead of ourselves here. I think what you're going to see for the next few days is minor differences between the different countries of the UK in terms of what the detail of the lockdown restrictions are. We are not heading for a situation where Scotland's in lockdown and England is not. And, if we ever got to that stage, and I don't anticipate that we will get to that stage, then clearly you have more fundamental issues to try to resolve. But let's not overstate the degree of detailed differences that we are likely to be looking at. What we are talking about here is the potential for different nations of the UK going at slightly different paces, because we are all potentially a slightly different stage of the infection curve that you all hear us talking about. So, these are important differences at times. We have to communicate them clearly. We've got to, all of us, avoid mixed messages and avoid undermining each other's messages. But equally, let's not exaggerate the differences that are likely to be in place. Derek Keeley from the Courier.
Thanks, First Minister. I wanted to ask you about that policy of allowing people out more than once a day and what kind of impact you would expect that to have on the transmission rate. Is it a case now of kind of wait and see, or do you have any specific projections you could share with us today?
We expect the impact on the transmission rate to be very, very minimal of this. I'll hand over to Gregor in a second. If we didn't think that, we wouldn't be doing this today. And the main reason in overall terms, and this will be why over the next week we'll also consider whether other forms of outdoor activity may be possible, is that while I am absolutely not saying there is no risk of outdoor transmission, because there is, so that's why keeping 2 metres apart from others, even outside, avoiding hard surfaces, because you can pick the infection up there. But the evidence suggests that the risks of transmission out of doors are less than the risks of transmission when you are indoors, which is why it is easier to lift restrictions outdoors than it is at the moment to lift them indoors. And that's why we've decided to make this one change today, because we think the risks to transmission are very low, but the benefits for people's health and well-being are potentially very significant. And I've said before, it is a worry every single day of the other impacts of what we're doing to tackle this virus. So the more we can relieve the pressure on people's well-being, the better, which is why I think this is a small change, but a potentially very important one. Gregor.
So the epidemiologists, modelling groups, the analysts have looked at this very, very closely. It won't surprise you over the last few weeks, the impacts of different types of change in the restrictions that we have in place. And what they've assessed is that this particular one that we've announced today, to be able to go outside and to exercise more often, has very, very little impact on the actual transmission rates. But with one caveat, as long as people continue to observe the social distancing measures, the physical distancing measures, the hand hygiene, all these other things that we've stated are really, really critical all along. And as we look not only to our experience in other countries to see exactly how changes in their restrictions, what we constantly learn is that using the models that have been used elsewhere, using the data and the impacts that other countries have experienced as they start to change their restrictions, we begin to learn more and more about how we apply those models within Scotland and what impacts that might have on our population as well. Now, as I say, this is one where we know that there are real health benefits to being outside more often. We know that actually exercising outside is something which is beneficial not only in a physical sense, but actually it's good for our mental well-being as well. And so we've judged, and I think it's a very fair judgment, that actually the risk of going forward with this at this time, despite the fact that R is still fairly close to 1, is absolutely minimal.
Thank you. And the last question today comes from Tom Magner from Carers World.
Thank you very much indeed, First Minister. A slightly different angle, if I may. The Dementia UK helpline is widely reported as having received an increase of 44% in calls. What assurance can you give that those with dementia, their carers, and the care homes in which some of them live will not get left behind or indeed forgotten in an exit strategy based on the needs of the economy and the wider population?
It's a really important point, Tom, and I think a good one to end on. I'm going to hand over to the Health Secretary to say a bit about the work we're doing to make sure that the risk you have rightly pointed out doesn't materialise.
It is a very important point, and I'm very conscious that the important restrictions that we have put in place in this lockdown, and particularly what we require to be happening in our care homes, is causing a difficulty of some considerable extent to people who have dementia and to those who care for them. Now, we have, I think, in Scotland, a very good dementia strategy overall, and we are now working with Scottish Care and with those advisors to see what more we can do so that there can be real clinical risk assessments done that allow us to balance the need for infection prevention and control alongside minimising and mitigating the distress that some of those measures are causing to people who have dementia and to those who care for them. And as we do that, we will, of course, work with the dementia organisations and the carers involved to understand from them what would help them. We've already, as you know, introduced a number of practical steps, but I know there is more that we can do, and that work is underway to see how we can add to all of that to help individuals in those circumstances.
Thank you very much. Can I thank all of the journalists for their questions today? Can I thank Gregor and Jean for joining me to help me answer the questions, and thank Rachel, our sign language interpreter today, for helping make sure this briefing is accessible to everyone. Can I also thank all of you, not just for joining us today, but for continuing to comply and to help us beat this virus. I'm very conscious that as we go into the next phase of tackling this virus, by necessity, our messages will become more nuanced. That will be true within Scotland as we start to lift some of these restrictions, but it may also be true because, for very, very good reasons, different nations of the UK are moving at slightly different speeds. That puts an even greater obligation on our shoulders to stand here every day and, as clearly as we possibly can, tell you what it is we're asking you to do and why we are asking you to do that. And for now, the state of the evidence leads us to believe that the progress we are making is real and significant, but very fragile, and that it would not take much right now to send the virus out of control again. I hope you agree with me that after everything we've all been through in these past number of weeks, it would be really, really, really wrong for us to take that risk and, in the process, lead to a situation where more people die unnecessarily. So please stick with it for now. My very clear advice to people across Scotland is, unless you are going out for food or medicine or to exercise now for as many times from tomorrow, for as many times a day as you want to, please stay at home. By staying at home, we are going to continue to get this virus under control. We'll continue to make sure that the pressure on our NHS doesn't increase and become overwhelming, and we will continue, notwithstanding the figures that I again have had to communicate to you today, we will continue to save lives. So please, please continue to look at the Scottish Government advice and to follow that advice. We are not asking you to do these things for no reason, and let me stress again, I will not ask you to do any of this for any longer than is necessary. But please continue the good work you are doing, because it is making a difference. We'll be back here tomorrow at the normal time tomorrow of 12:30. And in the meantime, thank you all very much for joining us.